Has it started?
Yeah.
Okay. Hi, I'm Jadira. I'm going to be your student physical therapist today. Today we have Adriana. She's a 17-year-old girl who comes in with right knee pain due to quad tendonitis. She is a athlete. She plays basketball and tennis, and she's a little deconditioned. She's missing about 2 degrees of knee extension, about 4 degrees of knee flexion. So today we're just going to work on some things to get her back in the game. Okay. First, to start, could you tell me if you're in any pain and rate it on a scale of 0 to 10, with 0 being no pain and 10 being you need to go to the emergency room?
Like a 3.
Okay, and where is that pain located? In the knee. Okay, cool. So to start, we'll just do some warm-up. So we're gonna warm up by doing some ladder drills. So I will have her do these in variations for 8 to 10 minutes. So I'm just gonna demonstrate for my patient, and then I'm gonna have her do a set. I would guard on the side or try to be next to her as she goes up and down, just to make sure she doesn't trip or fall or anything like that. And we're just trying to get the heart pumping and get those legs moving and get the blood flowing to the legs. So let me just demonstrate. So we're just gonna start here. We're gonna go in and out. And we'll go all the way down. So now I'm gonna have you come stand over here and we'll do that. You go at your own pace, a pace that feels comfortable and safe for you. Go ahead. Okay, so you can go ahead and have a seat and catch your breath for a moment. So now we're gonna go ahead and get into some of your workouts. So we're gonna start with some isometrics. So I'm gonna have you doing some seated quad sets. So I'm just gonna have you bring your legs up to the table. And for this, actually let me demonstrate first. So you will be here, and you would just press the back of your knee into the towel. You should see your ankle come off the table a little bit. Okay, it's your right knee. Yes. So during this exercise, I would just be guarding my patient's back to make sure she doesn't tip back or anything like that. And I would palpate her quad. So go ahead. Yep, wonderful. I feel a nice contraction. Okay, and so for that, we would do 3 sets of 10 with, actually, no. We're gonna do 15 of those with a 5-second hold. And to modify, we would just decrease this hold to 2 seconds. Okay, next thing. So now we're gonna do some plyometrics. So we're gonna have you do some reverse lunge knee ups. So you will start here in a reverse lunge. You wanna make sure that your back is straight, your knee isn't over your toe, and you're just gonna come up into a high knee. So with this, you're gonna be working your quads, your hamstrings, your glutes, and your hip flexors. When you're in this position, your glutes should be activated as well as your hamstrings. And then as you come up, your quads will be temporarily activated, and then your hip flexors, and then your hamstrings. I would palpate your hamstrings and your glutes while down, and then I would palpate your flexors and your hamstrings as you come up into the high knee. For these, we would do 3 sets of 10, and then to modify it, we would just do alternating lunges. Okay, so I'm gonna have you do that for me. And then I would just guard my patient on the side to make sure she's being safe. Yep, so back is straight, come into a high knee, and then back down. And on the alternate leg, you're gonna be activating your quads. So I would have her do 3 sets of 10 on each side. Okay, great job, patient. Okay, now let's move into resistance. So we're gonna do some goblet squats. So I'm gonna have my patient hold this dumbbell. To modify it, I would either take the dumbbell away or change it to a box squat. So we'll have my patient knees about shoulder width apart, and we're gonna go into a deep lunge and come back up. no, not a deep one, a deep squat, and come back up. And we're gonna do 3 sets of 10 for this as well. During this, you're gonna be working your quads, your hamstrings, and your glutes, and your hip flexors. I would palpate all of those. Go ahead, and then I'll say where I would palpate at which point. All right, let's do a couple more. So her glute should be contracting as she goes down, and then her hamstring should also be contracting as she flexes her knees, and her quad should be contracting as she comes back into standing. Okay. Okay, patient, throughout these exercises, what would you say your rate of perceived exertion is? With 6 being it feels like you're sitting on the couch, and 20 feeling like you've never worked so hard in your life and you're on the brink of exhaustion.
Like 10.
A 10? Okay, good. And I will also monitor her heart rate and her respiratory rate. Her respiration seemed to be normal, with the max being 20 before we should be worried. And she does have on a watch, but I would check her heart rate by manual. Okay. Now we're gonna do some balance. So we're gonna do single leg stands on the foam with a ball toss. And the right leg. Okay, so I'm gonna demonstrate first. So my patient will be standing here, standing on one leg, and I'll be tossing her the ball. And we're gonna do 3 sets of 10. If this is too challenging, then we would just remove the foam so that she's just on solid ground without the perturbations of the foam itself. Once again, I'm guarding on my patient's side, and I will be palpating her quads and her hamstrings to see as they contract to maintain her balance. Okay. Or I would have an assistant guarding my patient's side and or throwing the ball for safety. Okay, thank you very much, patient. All right, we've had a great workout, so now let's stretch and cool down. So we're gonna start with, you know what, while we're standing, let's just go ahead and get our hamstring stretch out of the way. So we're gonna do some wall hamstring stretches. So what I'm gonna have you do is sit on the floor, and you're gonna scoot your butt up to as close to the wall as possible, so then you can stretch your hamstrings out using the wall. But I'll demonstrate. Okay, so you're just going to try to walk your legs up to the wall to get a nice stretch on your hamstrings, and try to make sure that your butt is as close to the wall as possible. For these, we're gonna do 3 sets with a 30-second hold. Come on over, patient. So try to get your butt as close to the wall as possible, a little bit closer, almost there. Scoochie, scoochie, scoochie. Excellent. Now, you're just gonna use that wall and try to press into it and stretch those hamstrings out. I'll be palpating here to see if I feel a nice stretch, and I do. Wonderful. You will hold that for 30 seconds, and then you could just relax your legs, and we'll do 2 more. Very nice. You can stand up. And now we'll do our last stretch, which is a good old-fashioned quad stretch. Also, to modify the hamstring stretch, I would have my patient prone, well, supine, and then she could bring her leg up using a rope and make sure that knee is extended to stretch that hamstring. Okay, so if you don't mind laying on your tummy, we're gonna do a quad stretch. So for this one, basically, you'll be laying on your tummy, and then you'll put the rope on your foot and you'll pull forward to stretch your quads. We're also gonna do 3 sets with a 30-second hold. I'm gonna help my patient out and slip it onto her foot. And then she'll just pull forward and hold for 30 seconds. I'm gonna guard to make sure she doesn't fall off the side. And then I'll palpate here to make sure her quads are being stretched. Any pain?
No.
Excellent. How's your RPE?
Like a 7.
Okay, that's great. To modify this, I could also do it in standing with her holding onto her leg and pulling back to stretch the hamstring, and then bringing the table up to use it to help support her and keep her balance. Thank you, patient.
Thank you, therapist.